Okay, thank you.
Could we hear from Joanne Lepinen?
Hello. Is that working? Can you hear me? Mr. Chairman, committee members, thank you. It's an honor to be up here again this year. We do this every year. And I'm reminded of how far we've come in the medical marijuana program. I'm sorry, I need to introduce myself. My name is Joanne Lepinen, and I am the Executive Director of the Rhode Island Patient Advocacy Coalition, RIPAC. We're the medical marijuana advocacy group in Rhode Island. And I've been working with medical marijuana patients for over 10 years now, thanks to you. You created this program. This is a successful program. We see improvements in people's health that are beyond belief some days. Because of this program, there are people who don't have seizures anymore. There are people who thought they weren't going to live, another 6 months, and they're living full lives. There are people who have been sentenced to lives of chronic pain that really had no quality of life. That now are enjoying their lives, are interacting with their families. They've got their lives back. We have children who got their parents back. We have communities that got members back. It's all because of this program.
I've got Nancy's. I
know that there are several people that are going to testify that will dispute some of the facts that the police chief just articulated. So I'm not going to go too much into those, but I do thank him for acknowledging the fact that we have wonderful caregivers in this program that are doing really, really good work, and we'd like to keep it that way. And their privacy is really important. We need to protect them from being robbed. And honestly, you don't know where most of them are. They don't want you to know they're growing. And they don't have encounters with the police. So I think there might be a problem with the implementation of the law if the health department's not answering the phone to verify the cards for the police. We don't need to change the law. Maybe we need to fix the implementation. And I believe Norman Berenbaum's going to do that. I believe that there is a plan afoot to expedite those verifications. I want to talk today about House Bill 5555. We are strictly medical. We've never been interested in recreational use of cannabis. But I can see we do want to give a qualified support to this bill because in some ways this bill could really help patients. And I'll tell you why. We have a lot of patients who have fallen through the cracks. It can take a long time to get into the program. So what do people do in the meantime? They either go without or they might be able to, hopefully not get it illegally, but some do. We would like them to have legal access. We have sick people in this program. We have people who go into the hospital and when their cards are up for renewal. So they may have a lapse in license. We have people who get out of the hospital, they need their medicine. They want to go to the compassion center, but they can't because their license expired. And it may take quite a while before they can get it again. So inasmuch as this bill would provide at least some kind of measure for those patients, that would be worth it for us. But a lot of it is going to depend on how this is implemented. One of the things we've got to be careful of, this is a really successful program. We've got 17,000 patients dependent on this program. This bill is going to affect them. So it could make life better for them. It could also be detrimental. If I'm distributing, if I have a compassion center and I'm distributing to patients, but I also am going to distribute it to the recreational market, we want to make sure that those patients are taken care of first. And all the excitement, and there is a great deal of excitement about this new industry, we want to make sure that the patients have the products that they need. There are certain products that would not be popular on a recreational market, but that are for patients and that are needed for patients. So in that sense, I would like to work with the sponsors to develop some language that would require implementation of this to take the patients into consideration and make sure nothing happens to hurt the patients. Nothing happens to hurt the supply of the product for the patients. For instance, there's an advisory committee in here. I don't know why there isn't some representative from the patient community appointed to that to safeguard the implementation of the recreational program. I think that it should be a condition of licensure. If I have a license to distribute to medical patients, if I'm not doing a good job because I'm distracted, my license should depend on that. My license should depend on taking care of my patients. So we'd like to see that built into it. Also, I notice there's a hefty tax that's going to be going on cannabis under this bill. It would amount to 30%. One of the problems that we have, I mean, as much as a success as our program is, there's one of the biggest problems has always been access. If people have money, they don't have much of an access problem. But we have a lot of disabled folks who are very low income, and they really have not been able to consistently afford their medicine. You know, there's no third-party reimbursement here. This comes out of pocket for folks. And for people who don't have any disposable income, we have lots of people who are living on $1,000 a month and less. So it can be unaffordable for them. So we would like to see is the implementation of this program to benefit those patients. Because I'm ashamed to say that I had no patients that have been in this program for 11 years, and they've never had a consistent source of their medicine. And they get donations periodically if they can find a kind soul, but it's not consistent, and they suffer for it. So what we'd like to see is somehow the revenues be used to support the patients. For example, some suggestions. Right now, the compassion centers, there's a 7% tax on medicine. Why? People don't pay tax on their prescription medications. And again, there's no third-party reimbursement here. This is coming out of people's pockets, if they have pockets. So there's another 4% tax. The compassion centers are taxed monthly gross revenues 4%. That's passed along to the patients. Why don't we forgo that? Also, the costs of getting into the medical marijuana program can be astronomical for some patients. For some patients, just to get into the program, just to get registered, it can be as much as $500. Some of them have to go to the clinics because their doctors are unable to sign or can't sign. So there's doctor fees, there's registration fees. If they appoint a caregiver, sometimes it's as much as $500 just to get in. If we're bringing in revenues from a tax and regulate program, how about giving the patients a break? This is their medicine. So I implore you to be the compassionate beings that you have been by creating this program. And I think we could really help the patients and help those patients that this program was intended for. And hope we don't get too distracted with all the enthusiasm of this new industry. To that end, I know we've got other people who are going to speak. We're trying to be efficient with our time, Mr. Chairman. So we do support the expansion of compassion centers. You know, when we hear about prices in other states, they seem to be lower than they are here. We'd like to know why. Do we need more competition? We've got to do something, and we would like to make every effort that we could to make sure this important medicine that has become so important to so many people, that has helped them get off opioids, that has saved their lives, that they continue to have affordable access to it. That is our goal. We hope you'll support us in it. Thank you so very much.
Thank you, Joanne. One question. In your testimony, you mentioned some of the proceeds going back to the patients. I'm not going to comment on whether or not that's a good idea. Perhaps it is. I will only say when the argument to legalize for medical marijuana was being made in this building, the frequent call was that it'll increase revenues. So now that we've had it, and we've had it for a few years, all of a sudden, never mind the revenues, we want that to come someplace else too. So I worry about that with not just this issue, not with many things that we deal with in this building. First A happens, several years later, there's a request for B. So I make that comment. Any questions for Joanne? Okay, thank you so much.
Thank you.